Welcome to Fuzzybutts and Friends. Well, as much as it drives your Fuzzybutts absolutely crazy every time they hear me say it, I am the host of this show, Yer Big Dog, Luke Robinson, back with you again this week. And look over there, who do we have back again with us this week? It's our co-host, co-producer, and she's also the executive director of the Puppy Up Foundation, Ginger Morgan. Ginger, how are you today?
I'm I'm doing well. I'm sorry, what did you say?
How's the weather? I just automatically asked you that.
Oh, well,
Get
the weather is looking a little dreary today. Kind of
But
sleepy.
speaking of the weather, we just recently had the puppy up walk, and the weather was absolutely phenomenal. So there are times that we it's important for us to talk about the weather, I guess, and be grateful for it, I guess.
Exactly.
All right. You got on that note, if you don't have anything else new to add for us this week, on that note, speaking about the puppy up walk, we had a great time there. You guys walked. I got to interview four parents of cancer kids. Three of them were of the canine kind, and one of them, as you know, was Caleb, and he's the grandson of Peggy, our wonderful volunteer and part of the Puppy Up family for so many years. But I got to say, you guys were walking, I was doing interviews, and I thought that we had everything scheduled correctly, but I screwed up, and I was interviewing our guest during the last interview of the day. We ran long because we had so many wonderful interviews and so much wonderful information. And so we were running long, and right in the middle of the interview with our guest today, the band started playing. And I was able to cut it, well, salvage it. I couldn't cut it together, but it worked. I think everyone loved it. It was great. We got some great feedback for it, but we asked him and to come back on the show and tell the complete story hopefully without interruption. Maybe I might interrupt a couple of times. You know me.
I'm sure you will.
I'm sure I will. Our guest today, everyone, is Trey Cercone. He is a veterinary technician, and he is here with us to tell his story and Sammie's, which you may have heard on our last episode of Fuzzybutts and Friends. Trey, welcome to Fuzzybutts and Friends. How are you?
I'm doing well. I'm glad to be here.
I'm so glad you came back on the show to tell us the entire story. It's so fascinating. But before we delve into it and dig down deep into your story and learn all about veterinary technicians, who do you have there in your lap with you today?
That this little guy, his name's Ezekiel, but we call him Zeke. He is about a 7-month-old dachshund puppy, and he is the newest member of our family.
Welcome to the family, Zeke. He's a handsome boy, and I got to tell you, I say it almost every episode. My next kid is going to be a dachshund because I absolutely love them, and I think mentally I'm on there. We're here together, and I've met so many Trey on my travels, and I absolutely love their breed. I love them. I love dachshunds, and what's cool is almost everyone I've met has some really great, big, biblical or mythological name because they are small in nature, but they have giant personalities, right?
They definitely do. Growing up, we had 5 of them.
Five. So
we had 5, and the last one that was alive from those 5, he was 15. We put him down earlier this year. And a few months went by. I'm not a little dog person, actually. I didn't think I'd ever get another one. But here I am with him. So
But they're a big dog in a little body. I've had 3 dachshunds, and that's the thing about them is they don't realize that they're small. They have such a huge personality, and they think they're big. They think they're real big.
Well, they definitely do. He's already killed his first rat. He's bosses the other dogs around. He has no idea how small he is.
We wanted to talk about Sammie in particular and her story, but introduce your other kids. You have a full house. You are, as I say about Ginger, tells everybody she's a dog lover, and I met a bunch on my travels. And probably 90% of them maybe truly are, but Ginger truly is. So I call her a true believer, and it seems like, well, I know you are based on our interview. So you have a full house. How many Fuzzybutts do you have there in your house, Drake?
I've got 4 dogs total in my house, and then we've got 2 cats that hang around the outdoors. But I'm definitely a dog person, so We've got 4 total. This here behind me is Jasmine. And I know we're talking about Sammie today, but Jasmine's actually our unhealthy kid. Hey, hey, hey. Sorry, they're gonna be barking sporadically.
This is Fuzzybutts and Friends. I'm just glad we have Fuzzybutts on Fuzzybutts and Friends. I really am.
And Sammie, our cancer patient, she's over there. She's the little tan one. She loves to look out the window and try to guard the house. And then her little sister is over there with her. She's a American bully type thing. I don't know. I got her from the shelter. So they're all shelter pets besides this little guy here.
And we'll get into that in a second because you're a tremendous supporter and volunteer at rescues, and you're wonderful. Cheers to doing that. Yes, one of the things I wanted to point out is Sammie is very active, and that's good. And I tried to emphasize in my write-up about the podcast is all the stories were good stories. Were happy stories, and Sammie is doing well. And I want to let everybody know before we go into this, it's not necessarily going to be a sad podcast, but we are going to talk about some tough issues. And speaking of issues, Ginger, in the intro, I left out one thing, and I apologize for that. Is that the other exciting thing about this episode, Ginger, that I'm excited about, is that this is our first episode entirely about vet technicians, isn't it?
It is. It's the first time we've talked. We've talked to a lot of veterinarians, but we have not talked to any technicians as of yet.
And I apologize for that. I know we have vet techs in our audience, and I apologize because you provide such an important, crucial role in the patient management process, and at times that's emotional support, and in many other ways, as you know. So I'm glad that Trey, you're our first vet tech on here, so you actually have big shoes to fill, big paws to fill, big boots to fill. But from the little bit I learned about you, you are, I think, what I think should be the prototypical veterinary technician, because you seem so knowledgeable and you're very passionate. So before I shouldn't even continue, because I want you to tell us, before we get into being a vet tech and everything about it, I want you to tell us your origin story. How did you begin? How did you become such a crazy, wonderful, passionate animal lover and supporter? And how did that get to where you are today?
Yeah, so I'm an only child. My mom, she couldn't really bear any more children after she had me. So my parents filled our house with dogs to kind of keep me company. They had 2 dachshunds when I was born, and then that quickly turned into 5. And we had dogs in and out of the house, and I was just always around them. I've always loved them. I've always been I've been able to get along with dogs better than with people. I was very introverted as a child. I didn't really have many friends, so I definitely relied more on the animals. And I was one of those kids that just, grew up. I always wanted to be a vet. And I still might go to vet school, but right now I'm pretty comfortable in the technician field and everything. And so, I started with, I was a teenager. I volunteered a lot at the Humane Society, walking the dogs and stuff. And then I went to the University of Memphis and I got my biology degree. And I was like, what do I do now with this? Because I wasn't sure I wanted to go right into vet school, And
so you have an undergraduate degree already under your belt?
Yes, I have a bachelor's degree
okay.
In biology with a minor in chemistry.
Yeah.
Sure. And and then I'm actually, so I guess technically in my clinic, I would be what you call a veterinary assistant. I'm working on getting my certification, my license, and then that's what we throw the term technician around a lot.
Right.
Technically, what I would be considered is an assistant. So I'm actually working on another degree right now, my associate's degree, to get my license. And then after that, down the line, I may still want to go to vet school. I'm not really sure. We'll see what happens. But
you're young and you have some time to work it all out. Unlike your big dog here, and I still haven't worked that whole thing out in my head, in my life. So please.
I didn't mean to interrupt. So Trey, what is the difference between a certified vet tech and a registered vet tech?
So a certified, typically we kind of a certified licensed veterinary medical technician is a technician that has undergone, typically a 2-year program
Okay.
To get their associate's degree in veterinary technology. And then, I use Penn Foster. That's like an online college that you can do. So typically the time span of it, they estimate you can finish it in 2 years. You can finish it a lot faster, a lot slower, depends on how many hours a week you want to put into it. And you also have to do some externships with large animals and stuff. But then after you get your degree, you're eligible to take the veterinary technician national exam,
Okay.
and that will get you your certification in your state. Now you're going to have to take that test and become licensed in whatever state you're working in. Much like a veterinarian, you need to be licensed in that state to be considered, certified. I guess the term certified, you can be certified if you graduate and get your certification, but in order to be, an actual full-fledged licensed technician, you have to, pass an exam by the board, and then you can be considered, that you're working under a license.
Well, I appreciate you making that distinction that you're a veterinary assistant, because you're right, is that the default, even in my mind, is that everyone there is a vet tech. Much in the way, interestingly enough, that GPs, general practitioners, can treat, I guess, cancer patients without being board certified. Although we don't have enough board certified veterinary oncologists to treat them all. So we absolutely need the wonderful work that GPs do and help us out in there. But it is an important distinction, because that extra effort that you put into learning your trade, learning it is very important, especially as it pertains to I was dealing with pet parents and helping them in some cases, very crisis situations. So let's before we go, I wanted to give a shout out to your vet clinic. Who do you work for? What's your clinic?
So I work for Memphis Animal Clinic. We're the oldest veterinary clinic in Memphis. We've been here for over 100 years. The building has, at least. And we are over on East Parkway South and Central Avenue. It's a little brick red house. You can't miss it. It's got terrible parking.
Oh, that parking
is that the one on the
awful.
corner that the only way you can get into it is East Parkway?
Mm-hmm.
Yes.
Coming up
Airways, yeah.
If you're coming
East
up
Parkway,
the north side, you got to make a U-turn at the light to even park there. It's terrible.
Yes, but I took Grayson there though when I adopted. Actually, when I fostered Grayson, and he tricked me into adopting him. Still sore about that. But I'm kidding. I love my gray. But when I first fostered him, I guess he had to have treatments there. He had to have some treatments there, and I had follow-up care, and I took him to a clinic. And yeah, that was in COVID, so I don't think I ever went in at all. I had to sit out in the car the van out the entire time. But yes, you guys have been around for a long time. Well, let's give them a shout out. Yes,
because of the parking, I live in Cooper Young. I just walked my dog down. Like, first off, I got
a lot of our clients do.
Yeah.
That's what a lot of our clients do.
He needed the exercise, and so did I. So I just walked him down.
Yeah, and you're
right.
That
was a long time ago.
You're right next door to a really good doggy daycare. What's the name of that? Right there on Central.
That's it's Dogs Rule.
Dogs Rule. Yes.
And we actually, we have a boarding facility at Memphis Animal Clinic, and we kind of have a deal with Dogs Rule. They, if the pet parents that are boarding want their pets to get some extra exercise, Dogs Rule comes and picks them up, shuttles them over there, and at the end of the day, they come back and they sleep the night with us. So we've got a really good relationship with them.
Yeah, that's one of the things I like about them. I know them. We had an event early in the history of Puppy Up at their location. It was quite the event. And I only mention that because if they're listening, we're looking at taking sponsorships for Fuzzybutts and Friends. So we sponsor each episode. No, I'm kidding. I wanted to give a shout out to them because they're part of our history. And I can't recall, Ginger, what is the name of the lady that runs that place, that owns it?
Right now it's Katie, and to tell you the truth, her last name has escaped me. But
Fine.
yeah, originally it was Sally and Olivia that started it. That building was an antique store.
Yes, yes. Sally was the one I remember.
Yeah.
All right, let's get into the requirements. Ginger, you already discussed the distinction between the assistant and certification. But like you said, is that really anybody can kind of say they're a vet tech. Do you have any idea, Trey, the breakdown percentages of board certified vet technicians versus assistant veterinary assistants, or just whatever the general staff is there? Is it probably would be a pretty big number or small number?
At my clinic, personally, because we are such a small clinic, like I think there's about 13 of us employed there. Really, the distinction between veterinary technician and veterinary assistant, we all kind of do the same thing. The only difference is pay scale. Obviously, you get paid a bit more if you put that work in to earn your certification. Now, I used to work over at Memphis Veterinary Specialists in the emergency department over there on a Trinity. And, that's a much, much bigger facility. So the role between your assistant and your technician might vary a little bit. There's certain things that licensed technicians are usually expected to do, such as venipuncture and urinary catheter placement and stuff like that, while the assistant usually just restrains the animal. But in my practice, because we're so small, the technician assistant, we do all of it. There's 5 of us total as far as technician / assistant goes. 2 of them are licensed. 1 was licensed. She's not anymore. And then the other 2 of us are working on getting our certification. But we all kind of do the same thing as far as job description goes, which is why we kind of throw that term around loosely. But it is important to note that there is a distinction there, especially in larger scale veterinary facilities.
I think it is. Before we get into specialization, like you being an ER vet tech at a specialty clinic, I know them very well, MVS. Before we get into that, is one of the things I'm curious about is I talked earlier about the importance of the relationship between the vet tech or vet assistant and the pet parent, the client, whatever you want to refer to them as. And that's a very valuable, crucial relationship. And it seems increasingly so. It seems like there's less interaction and face-to-face time with veterinarians. Ginger and I have talked about this in the past. I don't know if we talked about it on the show, but it seems like now when you go in, they take the dog in the back and do some, if not most, of the examination in the back, and then bring them back out, and you have maybe 5 or 10 minutes with the veterinarian. And so if that's where the industry is trending, right, then the relationship between the veterinary assistant technician becomes increasingly important. So how valuable, Trey, can you speak to how valuable is that relationship? And then the second question is, in the certification process and the internship or residency or training process you have to go through, is there a focus on that relationship and being a bedside manner, something that a term we apply to veterinarians?
Absolutely, there is. Hold on. Hey, sorry.
You are watching this on our YouTube channel at fuzzybutstudios.com. Trey has just a bunch of kids in his lap. It's crazy. They're making a bunch of noise. There's Zeke. He's eating something. They're giving treats. Everybody's going crazy. It's Fuzzy Butts. They're happy. You got to watch it. It's crazy fun.
They're like toddlers. You got to have something to keep them quiet.
I follow some doxy groups on Twitter X, and I just love the videos. And one of the things that they repeatedly say is the constant need for touching and affection. It's pretty constant, isn't it?
Absolutely, they are very demanding.
Yeah, he's a tough guy, but he needs his loving.
Absolutely. But back to the client and the client and the technician relationship. I think that what you're saying is very accurate. Nowadays, the veterinarian's time is so valuable, and they have to see so many different pets, that oftentimes they're kind of rushed into a room. You get maybe 5 or 10 minutes with them, and then it's up to the technician to kind of start the room and finish the room. So the client's main impression of the overall visit oftentimes reflects, their interaction with the technician. When you go in there, especially, if it's a sick pet, you really want to find out what's wrong. You want to get to the bottom of it. Some clients, especially working ER, when clients are hysterical, you get these, little old ladies, and they're upset. They might talk and talk
Hey,
and talk and
hey,
talk.
don't go picking on little old ladies.
They might talk and
That's my
talk and
job.
talk. And your job is kind of to pick apart what they're saying and put it into a very concise list for the veterinarian. These are the concerns. You know what your vet is going to ask you when you go back there. Say if the patient is presenting for a UTI, they're going to know, is there frequency? Is there inappropriate urination? When did it start? Are we still eating? Are we still drinking? Any vomiting, diarrhea, coughing, sneezing? These questions that we can just go in and get an answer. But at the same time, you want to seem empathetic. You want to hear what the client is saying, because we really do care about the pets. But at the same time, our job is really to gather information for our veterinarian, and then to, where my clinic is, it's really important too. We got to go over costs and everything, make sure that we have approval to do what we need to do cost wise, budget wise, before we proceed.
Right.
And then typically we do take that patient to the back. Depends on the situation, but usually with more fractious pets, we definitely need to take them to the back, just because it's safer. We can handle them without the owner feeling the need to intervene. And sometimes people get sensitive about their pets being poked by needles and stuff, and we like to be accommodating of that. And then after the client speaks to the vet, it's often our jobs to finish up the room, meaning we need to go in there, make sure all the client's concerns were addressed. Sometimes they'll be like, oh, wait, I forgot to mention this. We want to make sure that, we address everything that they're concerned about at the visit. And if they have any medications that the vet has prescribed, it's always our job to go in there and make sure that they understand exactly how to administer the medication, when to start it, when they're supposed to come back. In my clinic, because we're so small, I mean, I honestly wear every hat. I play a receptionist too. I'll get them checked out. I'll say, when based on when the vet wants to see them, we'll forward book them, get them to come in. But our job is really just to make sure that they understand what is wrong with their pet, if anything, what they need to do to keep them healthy, and make sure that they understand that there is communication with us whenever they need us. We offer, I'll always tell people, especially post-op of any kind after surgery, I'll tell people, if you can't get them in that day and you have a concern, email us a picture, text us a picture, then call us and let us know that you just sent that. And we will sit on the computer and we will look at it right away. And if it's concerning, it'll go back to the veterinarian. And we try to be accommodating in that way, because we like to just have that people's reassurance that they can rely on us. That, once they're an established client and we've established a relationship, that they can rely on us to answer any questions they might have, any concerns. And I think the technician definitely plays the most crucial role in mediating that relationship between the client and the veterinarian, and making sure that the client's concerns get through to the vet and the vet's point gets across to the clients. Sometimes we have to break stuff down in layman's terms too. Our head veterinarian, Dr. Pauline Clayton at Memphis Animal Clinic, she's from South Africa. So she's got a heavy accent. And she uses a lot of terms that, we might not use every day as Americans. So sometimes after she leaves the room, I'll definitely have to make sure I can translate and break down what she says to our client.
By the way,
and
I
in that
love
way,
Dr.
I think
Clayton.
technicians definitely. She's amazing. She's wonderful.
Yeah, she really is. Luke, she was the one that tended to Grayson.
Okay.
After he was we took him there because he'd had his leg amputated prior to us getting him, and he did all the follow-up care.
We didn't have his leg amputated. That's kind of an important distinction.
No, that's what I was saying. No.
Yeah. Yes, yes. Okay, but back to your point. I'm going to put the pet parent hat on here because I have to. It's my job because I've been one, and I've got to say most of my interactions with vet techs, vet assistants have been very positive. Some haven't. We'll get to that maybe because I think case studies are very important. Feedback is very important, but I get what you're saying about a veterinary's time is important. But as you know, the cost of veterinary care is going up. And if I'm paying more for veterinary bills, my bills are going up, I want I want to make sure I get enough FaceTime with the veterinarian as I need to make sure that my answers, and every pet parent, I'm sure, feels this way, that their questions are answered sufficiently. I mean, I understand that that you do examinations outside of the room. I'm not a fan of that, I gotta say, because of the dialogue, because you do a much more thorough history with, like, say, you're doing like a physical exam of, let's say, Indiana, like where does it hurt, where does not. I mean, that back and forth conversation between you and the veterinarian when the examination has been done, some things there's a diagnostic value to that. There is. Not all pet parents, I can't guarantee, because most pet parents just say, I trust what you're doing, do what you got to do, I trust that. But then you have some that are me that are hyper educated and ask questions and don't really trust anybody. It's not a statement unless I really know you and I've seen the quality of care that you deliver to my kids. I'm going to question you and I'm not going to trust you because I've had bad experiences, particularly here in Memphis. But that's just the way it goes. So if I'm going to accept less FaceTime with the veterinarian, and that's fine. Like you said, in certain cases, it's just not warranted, and that's fine. I completely get that. Then I want to make sure the vet tech that I'm talking to knows what they're talking about. And so, as a pet parent and as a paying client of a vet clinic, I want to make sure you're certified. I want that additional commitment to you because you're right. You are the liaison. You liaise between me and the veterinarian. And again, if that examination is going outside of my presence, then I've got to make sure you deliver precise. And again, I'm not attacking you. Please don't misunderstand that. I'm more of an angry pet parent. Let me take it. I got to make sure that you get everything precise. Nuances. I try to use precise medical terms to the best of my extent, but I got to make sure that you know what you're talking about and that you could be that liaison. So, is there pressure? Are you seeing pressure from pet parents now that come in the clinic that say, are the pet parents? Here's a great question. I didn't even think about asking. Do pet parents come into your clinic and say, I would prefer to deal with a board certified vet technician? Do they ever ask that question?
I honestly have not gotten that question in my clinic personally. We do try to do exams in the rooms. I think the main issue with my clinic is the location. Most of our clients come from kind of the southeast of our clinic, southwest of our clinic. We get a lot of clients from Orange Mound. We see a lot of really, really, really aggressive patients. And they are
right. I understand.
We see a lot of mama pit bulls with cropped ears and porch titties that come in and they just want to eat us. And they're also usually very owner protective,
right,
and very untrained. And so a lot of the time, we have to take this dog to the back and we have to muzzle it and we have to jump on it to even be able to look at what's wrong with it.
Right.
And that's not really something we can do in the room with the pet parent. Right. Especially because a lot of pet parents will try to intervene. We actually had a lady get bit last week by her own pet.
Wow.
Because she wouldn't sit down when we were telling her to sit down. And so, sometimes if the pet is fractious, cats can be really tricky, especially when you're trying to flip them on their back, which they don't like, which is understandable. But if you need to flip them on their back to collect urine or something like that, typically they're not too happy about it. But whenever we have dogs that are, well behaved and it's just a standard exam. A lot of times, especially with Dr. Clayton, she likes to go into the room together, sometimes with me. And if it's a client she knows really well and she has an established relationship with, sometimes she'll just say, hey, let's just go in together and you can take notes while I'm talking to the guy.
Yeah.
But
well, again, I'm pleased. I'm not singling out the Memphis Animal Clinic at all. I know you guys, as Ginger said, I've had nothing but positive experiences there, even in COVID, and so everything's wonderful. But you understand my point. And
absolutely.
and obviously in high risk cases, you want to minimize risk to the pet parent and to yourself and to the pet. I hate using that term. To the companion animal, it's a risk management thing. I totally get it and I totally understand, which is why I was just talking theoretically, is that if that's where the industry is going, I'm going to be leading a charge to the extent that I can. There's no pet parents of the world unite, Ginger, out there. But to the extent that I can, I am going to be pushing vet clinics. Look, hey, I want your techs to be board certified, especially, and I don't think you addressed this. Especially if part of the certification process is pet parent care management, I don't know what to call it, relationship management, whatever it is, such a crucial part. And communication. I've studied history to know long enough that almost every big mistake and small mistake was made because of bad communication. And so communication. So back to that original question, do you know if it's part of the training or certification process that patient client management is part of that?
Absolutely, it is. There is an entire course on it that we have to take. A lot of it is, I guess the term they use that you hear most is customer service, but the client relationship with the technician and being able to create that good impression. When you go in there, you want to seem like you know what you're doing. You want to know what you're doing, but you also need to seem like you know what you're doing. You need to know how to talk to people. Because if you're unable to talk to people, this really is a people job. We deal with animals, but the animals can't bring themselves into the vet. It's our job. I wish they could too, but it's our job
and pay for it.
It's our job to get people to come in, and then it's our job to retain the client. Yeah. And if say they have a negative experience, and then maybe it's their first time bringing an animal to the vet, and they have a negative experience. If they're like, well, I'm never going to the vet again, I'm not doing that. Then their pet might not get the medical attention that it needs down the line. And so you really want to make sure that, you're creating a positive experience for the client and you're addressing all their concerns, right. And you're being accommodating of them. We have clients that, some have different needs than others. We have a lot of clients that, there's notes in their chart. They say, he has a hearing problem, try to speak clearer, speak up. This lady is autistic, go slow with her, or give help to this person getting in and out of the building. Let this person use the ramp. And we just like to try to create an individualized experience and make sure every client, when you're talking to them, it doesn't matter who it is. When you're talking to that client, that's the most important client.
Right.
And they need to feel that way.
Absolutely. Well, I think, I've had clients in many businesses, although I never had pet parents as clients, but it's similar in a regard. A client trusts you with something in their life and a value in their life, and it's an important relationship either way. And one of the things I learned early on, I still have to learn it, is that the most important thing, rather than presenting yourself as knowledgeable, which you need to be, it's very important. Most important thing is listening.
Absolutely.
It took me a while to learn that, to stop, talking about myself, even though I still seem to do that a lot, Ginger, but just to truly listen, because I know when I come into a clinic, I'm almost always in crisis mode, unless we're managing an existing situation and it hasn't worsened. If it's worsened, I come in, I'm a mess, and I try to communicate as effectively as I can. But I know to some, I sound aggressive, maybe hostile, whatever. I'm commanding, demanding. I just, to some people, I don't, I don't sync well. I have certain pathologies that provide tremendous benefits, but also they provide, and you understand that you're an introvert. You obviously understand you're given certain, qualities in life. And so for me, that's just listening is the most important step of that relationship, because I know I have a hard time sometimes. The communication for me is tough, right? It's hard for me to, and I'm sure like you and other people have a hard time truly communicating, especially at a time of crisis. So listening, that first step, man, when they come in, just listen and listen as best you can, because I know it's hard. I know it's hard for you. I know it's hard.
Absolutely.
Automatically, I would not want me as a patient. I have to apologize to every vet clinic I've ever been to, and every veterinarian and every vet tech that's had to deal with me. I'm sure I was a nightmare at times, but I fight for the proper medical care for my kids, and that's the most important thing, and that's why that communication that you were talking about is so important, because our kids, they're companion animals, they can't communicate what's wrong with them. They can't communicate to you, and they sure as heck can't communicate to me. So anyway, that's great. I'm so glad that the certification requires let's not call it customer service, let's call it pet parent relationship management is probably a good term, because it is such a go ahead.
I'm always interrupting because Luke is always talking. So sometimes I just have to. So one of the things that I do, as we'll call it a pet parent, is especially if my dog is sick and it's not a routine thing, is I make a list of everything that like started. This is Lily. This is what she did weigh. I don't know what she weighs today. Yesterday, 2 days ago, she didn't eat. Yesterday, ate a little bit. This morning, hasn't eaten anything. I'm making an appointment for tomorrow. This is what she's been eating. These are the medications that I make this big list of things. And then sometimes I even put boxes beside it so that we can check it off as I go over it, so I don't forget anything. And I typically will take a second copy of it so that I can give it to the people in the front, who then gives it either to the veterinarian or the vet tech or assistant, so we can go over it. So if they have any questions on what I've commented on, and I would imagine, I don't know, but I would just think that something like that would be good for every person to walk into the vet's office with. Even my dog Lily, the first time I took her to the University of and actually it was PJ that I took to the University of Missouri. He was seeing a nutritionist, and they were like, well, what color dog food bag? I'm like, what color? I was like, I don't understand. And I'm looking at the veterinarian, and she knew me, and she was like, what does it matter what color? He eats such and such, and they were like, oh, okay, well, a lot of people don't know. And I just
You'd be
remember her
shocked how many people, like, because that's always a question I ask regardless, is like, what food are they on? I don't know, my wife buys it. Like, how do you not know what your pet is eating?
It's, typically people feed it right out of the bag. They don't empty the bag into something. I would say maybe 10% of people do that. And so you've got the bag right in front of you. That's why the people didn't have when I told them, oh, he ate this from day one to and they were like, okay, we're good. You know what you're talking about. And the veterinarian would just kind of roll their eyes. They're like, no, you can ask Ginger anything about this dog. And you don't have to prompt her to answer, the question. So right. I thought it was funny.
If all the pet parents out there listening to this, that's great practice for you to adopt and get into. List all of the things that you think are wrong or not normal with your kid prior to taking them in. Even if you think or don't think they're related, they may or may not be. Some diseases can have very complex involvements, I guess. But Ginger is a very responsible parent. She is 100%, no doubt, and an ideal. She's a more ideal patient for you, or client for you than I am. That's for sure. But let's talk about that. I actually thought I put this on the bullet points, the talking points that I sent you, but Trey, I guess I didn't, because let's flip the coin now, and let's get back at people like me about pet parent responsibility. because what you're just saying a second ago speaks right to that. You have patients, pet parents that come in all the time, and they're not responsible enough to know what they're feeding their kids, and so they're horrible. They're horrible patients or clients, right? So that must be tough for you to deal with.
It is. And it comes with it definitely came with a learning curve when I started working at my location, because I would say that's probably 75% of our clientele. And when they can't answer questions, especially on the phone, when I'm trying to create, a new patient profile, and I'm like, is he, is she intact or has she been spayed? What does that mean? Can she make babies? I don't know. When was her last heat cycle? What is that? Like, what food is she on? Dog, it comes in a bag. Okay. It's from Costco, but none of that answers any of my questions. So a lot of times I go back, and when I'm filling the vet in on the case history, I'm just like, this guy has no idea about anything about this dog. It's just here for X, Y, and Z, but I can't give you any more history than that.
Wow.
So it definitely makes things challenging, as far as, and a lot of times too, it's their first time to the vet. It'll be a 6-year-old dog. They've had it since it was a baby, and it's never had any vaccines. It's never been to the vet, and they're just now bringing it to the vet because it just now has a problem. And there's no case history, so you don't know if it has any underlying issues, or you can't take in the whole picture. You can only look at, what symptoms it's presenting in front of you, because you don't have any blood work from a year ago. You don't have any previous weights. You can't tell if it's lost weight. You don't know what they're feeding it. You don't know.
Sorry.
Yeah, it's just it can make things really difficult, and it can impede the quality of care that you receive, because
Absolutely.
we're just doing the best with what we're given.
Absolutely.
Hey, Trey, I do pet sitting every once in a while. And I can assure you, if there's a couple, I could ask the man, like, oh, when was the last time the dog went to the vet?
No clue.
Oh no. What brand of food do you feed? I don't know. What, how long have you had your dog? I mean, you just ask, your basic questions. Some of the things like what you would ask, I was like, I don't know, like, who knows?
And the scary thing
my
is
wife
these people
knows.
have children. That's the scary thing. I'm like,
Yeah.
that's what but PSA to all couples out there, wives, either get it with the program, make sure your husband knows what's going on, or stop sending your husbands to the vet. Because it's always, let me call my wife.
Guys.
Yeah, I will. People on the phone, that's another thing we have to deal with. I don't know what it is, but I'm always like, you can wrap up the phone call and we can proceed with the appointment, or we can reschedule for when you're not on the phone. It is the rudest thing ever, but you'd be surprised about these people. I go in there and they're on the phone and they're just looking at me, talking, right. And I'm,
well, we can't be
hating on the phone call in the middle of your appointment because you don't know about the pet. Please just send the wife.
I got it. Yeah. So the guy is in the office and are there at the appointment, doesn't know a single thing about what's going on, has to make the call that delays the whole process. I get it. But when I was going to interject, I thought you were taking the conversation in a different direction. That's why I was trying to interject, is that we can't be hating on the male pet parents out there, the dog dads, because they're like me. God bless you. You do the best you can. Maybe you could do 20, maybe 40% better. You can. To the dog dads out there and the pet parents that are men, if that seems to be the problem, the gender that's the problem that we're discussing, I feel your pain. I know what it's like. But you got to step up. You got to do better out there, because you're right. You can't be. But I've got to say, ironically, I have been in a vet appointment. If I had to call Ginger once or twice and find out what's the dosage they're on and stuff, because my memory, my mind is just, it's a mess, but it's a beautiful mess, and my memory is horrific, and I don't take the notes and get all that. So you're right. Pet parent compliance is a very important thing. But that speaks to also education. And this, I want to kind of dovetail this conversation down to Sammie and her experience and that, because you learned a lot. You're very well educated. And I would hope, number one, your job would be listening, two would be communicating, and three would be educating. Because as irritating as it is, and not irritating, I don't want to use that word, as time consuming it is, because bandwidth, we all have to value our bandwidth in life. Everybody has to do it. It's what we got to do. And so educating takes time, and it takes a high degree of patience, which I've always lacked in my lifetime. But I've tried to teach and tried to educate, because I understand the importance, because you can very easily take somebody that doesn't know a few things or doesn't understand, and you can educate them, and you can make them an advocate. It's transformational. I'm sure, as you know, it's transformational. So I'm sure you employ educating into your part of your pet parent relationship management process, right?
Absolutely, we have to. And
what do you call them? SOP, standard operating procedures.
Standard operating procedures.
Yeah.
Yeah, for sure. We definitely have to. And a lot of it depends on if the client wants to learn. If they're reciprocative to the information and they're paying attention to us, we'll take that time to try to explain everything as thoroughly as possible. And we will also, to give them all the printouts and the handouts after we give them the information, just so that, sometimes if it's a big word that they don't know, they might not know how to spell it. And we want people to be able to Google it and do their own research beyond what we've just taught them. Because there's only so much you can teach a person in the span of 10 minutes. So, making sure that they have the resources they need to do further research is important. And most clients, especially, if their pet has just been diagnosed with an illness of some sort, are very, very eager to learn as much as they can about it. But unfortunately, we do get some clients that, it's like talking to a brick wall.
Right.
Or they're on their phones. And so at that point,
sure. It is important. It is important to point out, though, I'm sorry to interrupt, because I do want to get to Sammie's, and we do try to keep this at an hour, so my apologies.
Absolutely.
But it is important to the audience, because we have people all across the world actually listening to Fuzzybutts and Friends. At Memphis, that animal welfare and care is not a high priority in Memphis. That's just a reality. It's true in the rescues and stuff. So thank goodness, there are vet clinics that are, in yours as well, that are trying to provide a higher standard of care. You are trying to educate. And where I want to go next is specialization, because you worked temporarily for a spell at MVS there in the ER. So how, and we know a couple of things. We know that vet care is becoming more advanced and specialized, and it's following, of course, as I've always said, human medicine, and it's following logically, and it seems like temporally as well. And so what's next is you're going to have vet techs that specialize. So how close, Trey, do you think we are to having like oncology vet techs? How are we getting close to that? Because that's exciting.
Absolutely. And there are certain, technicians that I can't speak to as far as, certification goes and everything. I'm not too familiar with that process, but I do know that there are certain specialized techs for specialized doctors. Like Sheldon over at Bluff City, he works for Dr. Mitchner, and he works exclusively as her technician in the oncology department. And he's very well versed. If you need to email Dr. Mitchner, it's gonna go through his email, and if it needs to make it to her, it will, for sure, if you need to hear from her. But a lot of these things are questions that he can answer that a lot of regular veterinary technicians wouldn't know. I stay emailing him with questions. And, I know over at MVS, you have an ophthalmology department. They have, they don't do dental anymore. They have orthopedics. They do a lot of special stuff over there.
Allergies, scans.
For sure. The dermatology department is really big over there too. And they have, technicians in each department that are definitely more well-versed with those areas of medicine than would be just your typical standard veterinary technician like myself that just works in general practice or in the ER department.
Well, you may call yourself an ordinary vet technician, or if that's the word that you use, but you're actually quite really, Trey. You're very knowledgeable about cancer care and as it pertains to Sammie. So let's talk about Sammie's story. Let's hear it. It's powerful, and let's start with her story. Walk us through that, and then we'll talk about the treatment and get down to all the details and how she's doing. Okay.
Absolutely. So I adopted Sammie from the Humane Society in 2019 to be a companion to Jasmine, my other dog. Um, we thought Sammie was around 2 at the time. We're not really sure how old she is. We think she's probably around 7. So she's middle aged, about to become senior. Um, and she's always been really healthy. Up until recently, she had a bump appear, kind of on her right, no, it's her left thigh area. And it kind of looks like maybe a skin tag or an adenoma type thing, like a little benign mass, we thought maybe, but there's always the chance that it was cancer. So we ended up removing it, taking it off at the clinic where I work. And it was cancer. It turned out to be a grade 2 mast cell tumor, but it has a very high mitotic count of 10. And they suspect it to be more aggressive than a typical grade 2. So now she's undergoing chemotherapy currently. And she's just doing the oral chemo right now. It's a drug called Palladia. And it's a tyrosine kinase inhibitor drug. And she's just going to have to do a very short round of it this time, just 3 months. We had to go back in and resect the margins on that tumor, even though it was fully excised the first time. Dr. Mitchner was very concerned that local recurrence would be, very likely. And so we had to take more tissue down into the muscle fascia. And it's just now healing up. That was about a month ago. And it was a pretty, pretty difficult healing time for her just because of the location. There's a lot of tension on that skin and that muscle there. She didn't really have much to clothe in the surgery because she'd already previously taken out a tumor. She closed all her dead space in there really well. And so the incision ended up dehiscing about 3 times just from her walking around. And so we had to go back in, put some surgeon's knots and some staples in there. Finally, it's healed. It's starting to scar. But she's about 4 weeks into her chemotherapy right now. And if I could take one thing from the story to tell pet parents, it's just if you see any lumps or bumps on your dog, take them to the vet and get them checked out. If they're big enough, they can do a fine needle aspirate, which is where they just poke it and send it off. And, if it's a benign mass, like a fatty tumor, like a lipoma, then you can just leave it. But with masses that are smaller than like a grape, typically we just take them off. You won't be able to get enough tissue in a needle. Or if you're like me and you're paranoid, I always just jump straight to taking it off because I'd rather just have it gone and then only have to pay one lab fee of them doing a biopsy rather than a fine needle cytology and then a biopsy.
Right.
But if your pet has lumps or bumps, just take them to the vet, even if it doesn't seem to be bothering them.
We hear that every episode, it seems like. Lumps and bumps.
That's
we do it.
I'm going to die on the lumps and bumps hill. Trust me. I preach that all the time.
We do a puppy up cancer tip of the week every episode, and it seems like lumps and bumps is because, but it's so important what you're saying.
I think Trey just did ours. Thank you very much.
Yeah, you don't have to do your job this episode, maybe next one. But it's an incredibly important point that you're speaking to, Trey, and that is just don't wait, get it aspirated. I think you can get fluid in the size of a pea. is where I've got it. If you've got somebody skilled enough, you can get enough fluid out. And when you aspirate it, if you've got oh my gosh, we just lost Trey. Oh no, I guess maybe. Oh no, we just lost Trey. We're going to pause this episode and see if we can get it back on. Hold on, everybody. We'll be right back. Hope Sammie's okay. And we are back. Got to find my pen. Sorry about that. Trey had to relocate his house. Sammie and Zeke ate his phone. I'm glad to have you back. Okay, let's pick up where we left off because we're running a little bit long. My apologies. I ask a lot of questions, but I want to get back to aspirating. So important. And that's why we do go over it because it's so simple. It's an inexpensive procedure. And if you have the right veterinarian, they can typically just look at that underneath the microscope and they'll know if they see some crazy cells or not. If they see some abnormal cells, that will typically, in most cases, say, well, we need to get a biopsy. And because there is sometimes where you don't need to take off skin tags or is it hematomas or what is more common?
Lipomas.
Yes. Lipomas. Thank you. Lipomas. That's what skin tags and lipomas are the most common of the skin issues. And sometimes you have to put dogs under general anesthesia. And I've got my kid who's 12 and he's getting those things. And I aspirate them, always have them out as soon as I can. And but if they're not malignant, then he's 12. And so he has peripheral neuropathy. So anesthetizing him, putting under general anesthesia is just not, as you know, it's just not ideal. So I just want to mention that, and I wanted to go into diagnostics because what I liked about Trey, your story, is that you did the additional diagnostics about the mast cell tumor, and that's so important, pet parents. I'm not sure if you know this. I don't think I had time to share Hudson's story with you, but I lost my boy 2 years ago, and he had mast cell tumors for about 10 years, his entire life. And thank God, Craig Clifford, I think it's him. I'm going to give him credit for it because he's great. Introduced me to doing the I get them always confused. Not the P2K or the additional marker testing, diagnostic testing that you can do. You can speak about the science more technically here in a second. But it's important that when you get the diagnosis, you got to do the additional diagnostics. So speak to that if you can, the kind of testing you did and what precisely it means when you say high mitotic count versus or high mitotic index versus low, because thank God Hudson's were always low and we never had to do the additional chemo. So talk about the diagnostics that you guys did.
Absolutely. So, once the mass has been diagnosed as a mast cell tumor, you can order, like, there's an add-on test at the lab called like a mast cell tumor prognostic panel, where they'll take that piece of tissue and they'll, do some further testing on it. And they look for specific genetic markers in that tumor that can indicate how it may behave. It can help us to predict its behavior. It's not 100%, a guarantee that yes, it's going to do this. No, it's not going to do that. But it can definitely give the oncologist some insight as to what chemotherapy drug to use, if any, and what other medications and route of treatment that they should take with that patient. Because mast cell tumors are the most unpredictable form of canine cancer. We've seen dogs with really great prognoses, end up succumbing to cancer. And we've seen dogs with really bad prognoses with mast cell tumors end up living for 5 more years. So while this test is really important, and, if your dog does get diagnosed with a mast cell tumor, definitely go the extra mile and get that test, because if you are going to the oncologist, they're going to want those results for sure.
And hold on a second before you move on. And the other reason why it's important is, aside from the additional information and data that can better target and better treat, it also, in cases of low mitotic index, which was the case of Hudson, it spares them chemo unnecessarily. And I'm sure, as you know, chemo on dogs and humans, chemo in general, radiation in general, typically shortens your lifespan, can shorten the lifespan because it also can cause secondary cancers. It can create the microenvironment that creates a second cancer. So you're absolutely right. I didn't mean to interrupt you, but I did want to miss that.
Yeah, absolutely. And that's another thing too, is we never want to put a patient through chemo if they don't need to go through it. Sometimes, just holistic management can be enough to keep those tumors at bay. But when we're talking about mitotic count, what we're referring to is the rate at which the cells are dividing. When cells are dividing, it's a process called mitosis. And when you look at them under the slide, a microbiologist can count the number of cells that seem to be actively dividing on that slide. And they'll scroll across the slide. They'll take the amount of cells they see in each view on the slide and take the average. So if you have like a mitotic count of 10 per high power field, that means on average they're seeing about 10 dividing cells in each little view of that slide under the microscope, which 10 is a really high number. But if you've got a mitotic count of 1, 2, 3, those are lower numbers, and typically those patients don't need to undergo chemotherapy.
Right. And so you use that additional data, the high mitotic count, mitotic index, and then that helped you better target a therapeutic regimen for Sammie. And as a result, it seemed like Sammie, we saw her at the walk, it seemed like her lesion had healed okay. And even though she's currently undergoing chemo, she's very active and seems, for all intents and purposes, happy and healthy. So that additional data, pet parents, that you get can save you the cost of chemo and spare your kid the additional pain. Although I want to make the disclaimer, Ginger, this is always important. We dose chemo and radiation, maybe not radiation. I can't speak that 100%, but we definitely dose chemo differently in dogs than we do humans. And we always go at the lowest tolerable dose is what we typically go with, unless we're dealing with a very aggressive situation. And then we dose upwards. We dose more aggressively. So I didn't mean to use the word chemo. I didn't mean to associate chemo and pain, because I know there are pet parents out there that chemo scares the hell out of them because they think, oh my, it's just going to make this, they're going to reduce the quality of life and it's going to do all these bad things. But as you know, Trey, that's typically not the case, right?
For sure. And it certainly depends on, the type of chemotherapy drug that they're undergoing. I have never had a pet that has had IV chemotherapy. I know that can have that's a whole different can of worms. But Palladia, the chemotherapy drug that was developed for mast cell tumors specifically, is oral. And Dr. Michener, she explained to me that having it be oral was one of their goals because, a lot of pet parents, IV chemotherapy just seems a lot more scary to them than giving the dog a pill, a couple times a week. And understandably.
That's a very astute point. Yeah, we know that Cheryl London was, I think, the PI on Palladia. Ginger, speaking of, we need to get Dr. London on the show. But I think
Dr. Michener worked with Dr. London.
Correct. That's what I was going to say.
Dr. clinical trials.
But I think that was a wonderful and astute insight by her. Is that I never, to tell you the truth, Trey, I never really thought about that way. But that's absolutely got to be a reason. One of the reasons why some pet parents don't pursue it is they just think that IV, I don't want to do that. But quality of life is so important. All right, Trey, as we wrap it, but we know that Sammie's doing good. She's responding, knock on wood, she's responding well to chemo and therapy right now. And she's as the best as she can. She's happy and healthy. As we wrap this up, Trey, is there any final message that you would like to share with pet parents on either, other than, oh, we lost Trey again. All right, I think we're going to go ahead and wrap things up. My apologies to Trey. I think he had technical issues. He was recording on his iPhone, and I think he didn't have his holder anymore. He had to move to another room, and I think he was holding with his hands, and his hand was shaking. Truly an interesting experience here on a first for Fuzzybutts and Friends, but we have to accommodate our guests in every situation they have, and Trey had the day off, and also we got scheduling things mixed up, and so Trey was very accommodating. I want to thank him, and I also, Ginger, want to give a shout out to Ricky, Big Rick and the Troublemakers. I don't know why I'm not a part of that band. I fit right in.
You should be. Yeah,
yes.
Exactly.
Yes, I could be. But I want to give a shout out to them because it was not their fault. It was just our communication problem. And I didn't want to make it seem like that. It was their fault. It was not. It was our fault. And we love Ricky. We love Big Rick and the Troublemakers because they've been in support of our walk for several years now. So
they sure have. Yeah. He's
all
a
right,
huge animal lover.
They are.
I just want to add one thing
sure.
about Palladia. The way Dr. Mitchner also treated Lily, which, I always have to work Lily into my conversations.
Absolutely. Every episode.
And I know, but if this episode is airing on Tuesday, which would be the 31st, which is Halloween, correct? Then the next day is Lily's 16th birthday.
Wow.
But she was diagnosed with cancer, stomach cancer, the first time in 2018. We didn't do any chemotherapy or anything. Got good margins, found it early. In 2020, it reoccurred in a different area, and then she was put on Palladia. So the first, as you said, we gave her the highest dose that we wanted, that she could maybe tolerate. And she did have some stomach issues, so we backed off of it just a little bit. But Lily was on Palladia for a year and had zero side effects to it at all. I mean, she acted like she acted like your regular dog. She wasn't sick. Right. She ate, she played as much as a dog at that time was 13 years old. So, and I thought it was funny when Trey said that Sammie was middle aged or a senior. He doesn't know what seniors are. Well, I didn't get to tell him that Lily was 16. So anyway, I look forward to maybe running into Trey a couple of times this year with some puppy up events.
He is. He's he's a very interesting fellow. He's young and he's got his head on his shoulders, and he's got, I think, a clear vision of at least what he wants to do in veterinary medicine. And we wish him the best. I want to thank him and Sammie and Zeke for coming on the show, and his other kids too.
Yeah.
I didn't write their names down, unfortunately, but thank all of them. But I think he represents the future of vet techs, and I think I know he represented very well.
Yes, he did.
All the vet techs in the country. I think he spoke well, and he's clearly takes it up a notch, and he wants to provide the quality care for pet parents. So I'm very grateful to that and all the vet techs that we have, because actually Puppy Up is filled with vet tech volunteers.
So we are.
And we're part of your team, and we're on the same team. That's the thing. And we just got to learn more and do better. That's all we got to do. So on that note, Ginger, thanks again to Trey and his kids, Sammie and the rest of his kids. Did I screw up anything other than the technical difficulties?
No, not this time. And a shout out to Trey for doing my cancer tip of the week.
Well, we should have all of our guests do your job, Ginger. That would be perfect. All right, everybody, we'll leave it on that note. Thank you so much for tolerating us this episode, and we'll see you next week. Puppy Up. Talk soon.